Covid-19 è il nome di una malattia virale.
COVID-19 is the name of a viral disease caused by the SARS-CoV-2 coronavirus. Coronaviruses are a family of viruses responsible for infections that mainly affect the respiratory tract, with mild forms such as colds and severe forms that may require hospitalization. How is the virus transmitted? Transmission can occur directly from one infected person to another, or indirectly, through contact with objects in the environment around the infected person. In the first case, the person with the infection releases the virus into the air, through coughing, sneezing, or simply by talking. A susceptible and unprotected person who is close to the contagious person can breathe the air containing the virus and acquire the infection. In the case of indirect transmission, the virus released by the contagious person is deposited on the surfaces around him. A susceptible person, by touching the surfaces, can carry the virus to the mouth, through the hands, and thus acquire the infection. So, how can we prevent the transmission of the infection? The strategies used aim to put barriers, physical and not only, between the contagious person and those surrounding him. First of all, it is important to get a vaccine, in order to develop immunity against the virus in our body. The vaccine does not eliminate, but drastically reduce the risk of contracting the infection, and to reduce the risk of having a severe disease. The contagious person must then be isolated in an environment dedicated to him, where other people enter only with the necessary protections. In this way, the contagious person will not come into contact with other people and will not be able to transmit the infection. For people surrounding the contagious person, the main rules are: the use of face mask, to be used every time you approach the contagious person and in public environments, according to current regulations. Hand hygiene, with hydroalcoholic solutions. Environmental hygiene, which includes cleaning surfaces and aerating the rooms by opening the windows regularly. Given the way the virus is transmitted by air, and the fact that not all contagious people are symptomatic and therefore are not identified, another important measure is social distancing, namely maintaining a physical distance from the people surrounding us. What are the symptoms of COVID-19? COVID can manifest itself in various ways. It can have mild but even severe forms, especially when risk factors such as old age and other disease, for example cardiovascular disease, are present. COVID-19 is mainly a respiratory disease and can manifest itself with cough and difficulty in breathing, with rhinorrhea, runny nose, and sore throat. Usually, there is fever, headache, and widespread osteomuscular pains. In some cases, gastrointestinal disturbances are associated, such as nausea and vomiting. Some specific signs of COVID-19 are the reduction of smell and altered taste. However, it must be remembered that in a number of cases, people with COVID-19 do not have symptoms. When there is a suspicion of coronavirus infection, the test to be performed is represented by nasopharyngeal swabs. These are available in pharmacies and healthcare facilities. Inquire about the place which is closest to you, but can also be done at home. What should be done for COVID-19 cases and contacts? Proper case and contact management is the key to control the transmission of the infection and to ensure adequate care for those in need. In case of suspicion of COVID-19, a health professional must be contacted for a confirmatory test. In the event of a positive outcome, the infected person must be isolated and monitored to assess the possible appearance of serious disorder, such as respiratory failure. The contacts of positive cases must be monitored to detect the possible appearance of symptoms and possibly be tested. Let us remember that even an infected but apparently healthy person can transmit the infection to other people. To conclude, it is important to stay informed on the trend of infections and the rules to be followed. To comply with the hygiene rules for the prevention of transmission. And remember, if you have any symptom compatible with COVID-19, consult a healthcare professional.